came to Guben to be part of the first ever fascial plastination project in history. We were tasked with dissecting only the fascial structures out of a cadaver where they can try to be preserved and highlighted at the next Fascia Research Congress. And the whole idea is about education for the masses to understand about this largest organ of the body, the fascia.
So 25 people from all over the world, from Australia, from South America, from North America, from Asia have come together here to support a project which also has some historical dimensions, to work on the first fascial net representation in a Body Worlds exhibition. So far in the Body Worlds exhibition, you see the nervous system, you see the circulatory system, but the fascia has been largely ignored. And now we want to focus on it, and that should serve as an educational tool to teach medical doctors, to teach Pilates instructors, to teach many other professions that they should only look for a local solution, but for a connected networking, influence sharing in the human fascial net. So if you have a scar tissue down here after an appendix surgery, maybe you are open to look for the left shoulder, because in a fascial net, and you will see that in this whole body of plastination in the future, where you can see where the main lines of force transmission happen.
What we've learned with fascial dissection is the fascial lines crisscross and go from here down and across and in and through the back. It goes down, across and down. So fascia and yoga, they go hand in hand. Pilates, Joseph Pilates was one of the first fascia guys. Acupuncture is another 4,000-year-old process. They put the needles where the fascial sheaths intersect, and they twist the needle, and that fascia, that tissue, wraps around the needle, causing a stretch and a glide underneath the muscle. So what's that? How does it have to do with fascia? Everything. And what we say is Eastern medicine has been right for thousands of years. So today we're going to roll the main areas where the lymphatic vessels and lymph nodes are, specifically where those neurovascular bundles get impinged and it doesn't allow proper drainage of the lymphatic fluid. One of the first areas I'd like to start at is the adductor. There's 5 muscles here, and if you take your thumb, you can actually put your thumb in that hole where the aorta dives into the thigh and becomes a femoral artery. What we're going to do, you're going to take your roller and put it in a longitudinal position. Your right thigh is at a 90-degree angle to the roller. I'm going to lift my weight up on my left toe, and you can actually feel that pectineus from the pubic bone to the femur. Do you guys feel that? Our goal here is to help facilitate proper lymphatic drainage through the periphery into the lymph nodes, so that all that water that lives in our fascia can be filtered, which in turn reduces the amount of inflammation. Instead, your body's in a neutral state so it can repair and rebuild and just rejuvenate your tissues. Let's switch to the left side now.
We think that one of the key elements of the fascia is permit the gliding between the different surfaces and permit to, and in that way can connect various elements each other. So if the fascia can't glide, the receptor inside the fascia are triggered and we feel pain. It's one of the problems. The second problem is that if the fascia is not able to glide, is not able to transmit in the correct way the force at a distance. So the fascia that usually work as a bridge can't work in that way, and we miss the connection between muscle or among organs. And that usually, from a clinical point of view, appear like a lack of coordination, a lack of proprioception.
In the base of your skull is your brain, and there's 12 nerves that come from the base of your skull, not out of your spinal cord. Some of those nerves, you have 3 trigeminal nerves, your facial nerve, vestibulocochlear nerve, auditory nerve, glossopharyngeal nerve, and my favorite, the vagus nerve. Vagus is known as the wanderer. It goes from your brain to all your organs. So I have a question for you. If I'm having pancreas issues, is it my pancreas or is it the wire that my brain is using to talk to that pancreas?
I see in my clinical practice every day how much important is the fascia to understand really a patient, because a patient that come with a problem in the knee, a problem in the shoulder, a problem with headache, actually are treated by different specialists in different way. But understanding the fascial continuity, we can understand that this problem could be just a different aspect of the same fascial problem, and we care the patient altogether. And that can change really the medicine.
The next area we're going to roll is in the axilla, the armpit. We have lymph nodes here. Your breasts have lymph nodes and lymphatic vessels. They drain through this gutter. The way we do it, this is the beginner version. Extend your arm out. I'm going to lay back gently, and I'm going to go forward. And don't be surprised that it's very tender. And do you feel the blood rushing to your fingers as well? Do you feel that? This also helps with neuropathy. This helps with tendinopathies. This helps with edema post-lymph node removal for breast cancer. Okay, now let's see the after. Let's make that arm move in circumduction again. So imagine, we've had people who have gone to physical therapy for 10 weeks for frozen shoulder. I see them for 10 minutes and they're like, "How did you do that?" I said, "I didn't do it, you did it yourself." And that is the whole idea behind this process and this product. You can see someone for 10 weeks and leave scratching your head. Why do I don't feel any better? Or you can learn how to take care of yourself every day for the rest of your life. The fascial organ system has the capacity to hold about 15 liters of water. For America, that's about 4 gallons. So I want you to think, if I poured 15 liters of water on the floor, that's a big puddle, yes? Well, most people don't even drink what they're supposed to on a daily basis. So the majority of people walking around, their fascia is tight. And when it's tight and dry, it can put about 2,000 pounds or 1,000 kilograms of pressure per square inch on your pain-sensitive structures. So instead of giving me pain pills or muscle relaxers or antidepressants, if I teach you how to take care of your fascia will take care of you. So we have a saying, it can be your best friend or it can be your biggest nightmare, because dry fascia is where cancer cells embed themselves. And there's some evidence showing that you can get rid of migraines. I have clients who had migraines for 40 years. We're gonna help you out of here, Joe, a little bit lower, and pull the chin back. Good, I'll make sure you're all in the right place. 5 more seconds. When you sit up, don't be surprised if colors seem a little more bright or vibrant.
It has probably a similar importance as other tissues, as musculature, as the nervous system. However, this connective tissue, the white collagen fibers, the loose and the dense connective tissue, is almost everywhere. Because it's everywhere, it has been overlooked. You cannot compartmentalize it so easily. And that's what the male scientific mind loves to do, to cut it into countable pieces, 6 or 7 or 5, give it names and discuss the relationship. And that is very hard to do with the connective tissue. That has been one reason. Another reason has been that we couldn't quantify it so easily. But now we have a terminology where we can describe it exactly, and we have measurement tools. And maybe that's the reason why now suddenly many fields in medicine realize, holy cow, why didn't we realize it before? It's everywhere and it's very important.
I think people need to understand this science of the fascia, the work that these people are doing. It's changing lives, it's saving lives, and people have to get some Q-tips clean these ears out and listen to the information that's coming. It's not crazy science, it's real, fact-based, proven science. That's all I have to say about that.